Nita, particularly given your breadth of expertise and interest, I'm fascinated by the fact that you chose to write one particular article in relationship to the pandemic called Proof of Vaccination Will Be Very Valuable and Easy to Abuse. Can you share with us what the intention of that article was and why you chose to focus on it?
One thing that was pretty clear to me as soon as the vaccination campaign started, and as soon as companies and others started to jump on the bandwagon of creating things like digital passports, and of course, even earlier in the pandemic, as people talked about the concept of immunity passports, as people recovered from getting COVID, was the potential for abuse of this system. As Jason discussed some of the distribution politics and the challenges that we have faced, not just with respect to things like respirators, but also with the distribution of the vaccines, the plan that we have come up with respect to distribution of the vaccines is based on where we are in the pandemic, right? If we were at a very different point in the pandemic, we might not have chosen to vaccinate the most vulnerable, for example, first. It might have been to stop the spread of the virus. It would make sense to, first vaccinate people who are younger and more likely to spread the vaccine, right? So it reflects the moment that we're in. It doesn't reflect necessarily anything other than that. And as a result, it also doesn't reflect the ways in which the pandemic have affected people socioeconomically, right? So the people who have borne the greatest risk and the greatest impact socioeconomically are not necessarily the ones who are going to have access to the vaccine anytime soon. And in fact, we're seeing quite the opposite. We're seeing lots of people gaming the system, even people who have access to resources or to technology or know how to make appointments quickly or have connections are figuring out ways to get the vaccine sooner. So I wrote that article with a recognition that as people started to see the vaccine rollout and started to have things like, I'll just flash this quickly. This is my vaccine card, which shows that I've been vaccinated because I was part of the Moderna study as part of the clinical research study. And as an unblinded participant now, I know that I received the vaccine. That vaccine card should not be my entry ticket back into society. At least not right now, right? We do make vaccination an important consideration for things like attending schools and other issues once it's widely available and it has full regulatory approval. But I was concerned that first, it would raise significant equity issues to condition people's reentry into society based on whether or not they had a vaccine card or existing immunity. And that jobs and availability of resources, the ability to go to a restaurant, the ability to be able to attend a venue or an outing or a concert, if it relied upon your access to a vaccine card and there's maldistribution already of the vaccines, that would further create this divide that the pandemic has only exacerbated. The second is that I worried that there would be a significant risk that people, again, would misunderstand, right? One thing that we still do not know the answer to, and there is some evidence in both sides on this, is what does it mean to be vaccinated for other people, right? If I'm vaccinated, my risk of severe disease has gone down drastically. But does it mean that I'm not going to spread it to other people? Will I remain asymptomatically potentially infected and able to infect other individuals? And if we reopen society based on this lack of understanding, that it would exacerbate these problems I was talking about earlier, undermining public trust, but also returning us back to this place that is really based on individualized ethic rather than community ethic. My behavior hasn't changed much because the rest of my family isn't vaccinated. My children aren't vaccinated. My husband was also in the Moderna study. He wasn't vaccinated. He was given the placebo. And so my behavior is based on the risk to the other people that I can come into contact with, or my parents who weren't vaccinated until recently. And then the third was, creating this black market, right? Which is once you start making it contingent for people to gain reentry into society based on things like a vaccine card, you create a significant risk of forgeries, of people who are, bartering these types of cards. I think that creates a black market. And that's problematic. And then I'll just say as a side note, given that I'm so concerned about public trust and transparency, it's important to remember that while there's very good data on these vaccines, it's still limited in time. And that's the reason why they have emergency use authorization and not full regulatory approval yet. And requiring people or conditioning participation in society on taking a vaccine that does not have full regulatory approval yet, I think further undermines public trust in science, and creates a greater degree of mistrust, particularly among the communities where that mistrust has been so deep and so problematic, like minority populations throughout the United States. And so I personally wrote that article because I thought this is a moment at which people are going to make some serious missteps ethically about conditioning participation in society based on vaccination status. I'm all for people getting vaccinated if they want to get vaccinated, and I hope that vaccines will be as widely available and accessible to everybody who wants them and for everybody who needs them. But I certainly don't want to make people's ability to participate in society right now, when that's not the case, conditioned on whether or not they have a vaccine card.